Yep, we're good. Okay, welcome. Thank you, everyone. Thanks for your patience here. I'm still getting used to this new setup. So welcome. I'm Ryan, ADHD dude. I appreciate you being here tonight. So I'm just gonna get started with questions and jump right into this. Mo asks, what meds can somebody with high blood pressure and panic attacks help with AD? I'm not a doctor. I can't answer any medical questions. So okay. Um, so Sarah asked, "What is a good way to?" Also, I'm sorry. Before I read this question, let me just ask: if you want to submit a question, please mention your child's age if it's relevant, because that will help me. Without having age, it's a little hard for me to comment because I need to know where they are developmentally. So okay. So back to Sarah's question. What is a good way to respond to a defiant child who thinks nothing is ever his fault? He says kids don't like him or want to be his friends. So those are actually two different questions there. In regards to thinking nothing is his fault, I would say if you start getting into a back and forth about whether something is his fault, I call that getting sucked into the argument vortex. Okay, don't get sucked into the argument vortex about it. He knows what it's his. He knows if something is his fault. Okay, and he probably feels ashamed about it. And kind of making him verbalize that really serves no constructive purpose at all. Okay. In regards to saying he says kids don't like him or want to be friends, well, that could be true depending if he does things to upset them, offend them. One of the aspects, or really the biggest aspect of social learning challenges or difficulty with social skills, is a lack of perspective taking. So, difficulty understanding others' thoughts and feelings and understand how you come across to others. And I just want to be really clear that that is not a lack of empathy, because that drives me insane when I hear people say that their kid lacks empathy, or I hear therapists say he lacks empathy, things like that. It's difficulty with perspective taking. Okay. So let me move on to the next one. My child blames everyone else for messes he makes because he doesn't want to clean them up. He's 6. So what I would say to that is, let's talk about, is a mess that he can clean up himself? Okay. Well, if so, then he needs scaffolding around how to clean up. Okay, so for 6, I wouldn't expect him to necessarily be able to do that on his own. So for instance, I'm just going to use a random example. Let's say there's, he has like a toy box, okay, and he takes things out of there and then doesn't put them away. Or he has a shelf where everything goes. What I would do is take a picture of the shelf, of what it's supposed to look like where everything goes, and we want to hang that exactly next to the shelf. All right. And we can break it up into zones, and I teach a strategy for this in webinar 4 of Executive Function Crash Course. Because what we have to do is we have to help him visualize what the space is supposed to look like when it's clean, and then help him break it up into manageable chunks by defining the space. Okay. So again, this is a strategy I teach in Executive Function Crash Course for parents. And what we want to do is we want to not get into constant prompting, although it's 6, a lot of prompting is still necessary. So, don't get into a power battle about it, just understand he needs scaffolding to help him understand how to clean things up, in a systematic way. All right. Of course, Lisa, it's fine for you to be here, and I hope you'll join us next week, because next week is when I'm talking about 5th graders. Okay. Dana said, what strategies do you suggest to teach emotional regulation 9 years old? Yeah, Dana, that's a little bit of a broad question. It's kind of, I need to have more context kind of for understanding it. And there's a few different things I like. I like the zones of regulation program. What I would suggest is don't try to teach that yourself. I have a saying for parents: stay in your lane. Do not try to be therapists. Do not try to be, occupational therapist, social skills coach, and so on. But look around to see if, you can certainly orient yourself to the material. You didn't say how old he was, but, oh, you did. Okay. Yeah. Okay. So 9. So I would say, yeah, I like zones of regulation. Okay. But let's keep in perspective here. Okay. That at 9, his executive functioning is more of a 6 or 7-year-old. Or I'm sorry, 7 to 8 years. No, 6 to 7-year-olds. So we have to keep in mind that some of this is going to come with brain development. Okay. So I do like zones of regulation program. A lot of people like the work of what's her name, Kelly. I think it's Mare, interoception, I think it's called. But the two big things I use are the Zones program and some things from Social Thinking. Look in your area to see if there's somebody who does a Zones program, like an occupational therapist. That's what I would suggest, and you can also familiarize yourself with it. Okay. So Julie asks, son is age 9. What are our sons? Some of our what are, excuse me, what are some suggestions to help with our son's resistance to strategies? So, Julie, what I do is, one of the things I always say is that flexibility is cultivated, inflexibility is accommodated. Okay. So part of that is you're not going to get into a back and forth argument about his resistance. It's basically as simple as this. So here's the choice. You can choose to use a strategy, and you can choose to have, your iPad time later, or you can choose to make your, let me say it this way. You can choose to make your brain be flexible and have and use a strategy and then have your iPad time right after, or you can choose to keep your brain stuck and not have your iPad time later. So what we're doing is we're putting the accountability fully on him to be flexible and to make the choice of whether he wants to use it or not. Okay. That's one of the things I find with inflexibility a lot is parents get way too into going down the negotiation, the reasoning vortex, or they don't put the accountability on kids. So, if we want to cultivate flexibility, well, number one, we have to incentivize it, but we also have to use what I call language of accountability. And that's when we put all the accountability on kids. So that's the language I'm using when I say you can make the choice to do A, or you can make the choice to do B. If you choose to do A, you will get what you want. If you choose to do B, then you've chosen not to get what you want. And what that does is it takes away from using reactive language like, do this or I'm taking this away, right? That's not helpful, right? Because when you do that, then kids can make themselves a victim and say, oh, you took this away from me. And what we want to be able to say is, well, you decided not to have your iPad later, because you chose to keep your brain stuck today. All right. Let's see. My 10-year-old has a lot of trouble falling asleep at night and often will lay in bed for hours. Yep, I dealt with this twice this week, Jeff. We suspect his mind is racing. Yep, and it keeps him awake. Any suggestions on helping him sleep? Yeah. So, Jeff, this is something I'm going to cover in the new webinar series. It's a little too much to get into here, but basically what we have to do is we have to kind of break the process of transitioning to bed down into steps. So let me just give you the overview. So first thing I would say is, you can, read some, a story with him or whatever. Then after that, let him lay in bed with a book to look at. And I don't mean like something to read, but more like, like one of the Marvel, like more graphic novel kind of things, comic books. If he wants to look at a card book or, anything like that. And then the final step is, lights out and have him listen to an audiobook. Okay. So that's kind of the transition into that. I can tell you any family of elementary schoolers who I've suggested this to, it's really been incredibly helpful. And I guess the other thing for you to think about is, also, how late in the night is he on screens? Because that could have something to do with it. And I don't mean TV, I mean iPad or computer, whatever. So, okay. And again, Jeff, I'll cover that in my, in the upcoming webinar series, what I just told you. So Lisa asked, my son is 8. He'll be moving to a new school next year. Any advice on how to prep him for the transition? What I would say, Lisa, is, like a few days before school starts, see if, ask the school if you can come in and he can kind of walk around, see where his classroom is, get oriented, even if he could see what his schedule will be, and kind of you can walk through his schedule with him. I think that would be really helpful, because remember, for kids with ADHD, their future thinking skills are really kind of based on their age. So I think if you can help him kind of prepare for that, for, the physical layout in the building, and if whatever transitions there might be at 8, he's probably not transitioning to any classes really, but I think that's what you could do to be helpful. And obviously, maybe if you ask the school if they can hook you up with another family who's in his class of another boy, and maybe they can meet beforehand, so at least he goes in there feeling kind of comfortable that he knows somebody. I think that would be good. Eileen asks, my son is 7. He constantly makes noise. Yeah, that's what 7-year-olds do. We asked him to please be quiet. He is for about half a second and then starts up again. What do we say to make him quiet for longer? Well, Eileen, I don't think the thing here is to try to get him to be quiet for longer. I think what you have to look at is, is this kind of is this sensory related, which I often find it is for his age. It's kind of, whether it's kind of soothing or some kind of stimulation. So ask him, find out, say, does it help calm your brain down? Does it, make you, kind of calmer inside, find out a little more what it's about. And I think the thing is, the other part of it, if he says, I don't know, well, that's okay. But my guess is it's either that it's sensory related, or he's doing it for attention. And, I always say for kids with ADHD, much easier to get negative attention than it is to get positive attention. So I think that's what you have to discern, the difference between. All right. Erica asked, hi, Erica. We try to show him how to be fair. He picks music. Then next time his sister picks, good. But then he gets obsessed with things being fair and cannot cope when they are not fair. So, Erica, the whole thing with that, it sounds to me like you're getting, sucked into the reasoning vortex where you're trying to reason with him about what's fair, and the whole thing is to not go down that route with him, okay? So there's just no discussion to be had. If he knows that this is how it works, he picks a song, then your daughter picks a song, fine, okay? There doesn't need to be discussion beyond that. Anything else is getting pulled into the reasoning vortex, and it's just not necessary. And it's reinforcing that behavior with attention, with your undivided attention, okay? Lisa asked, how do you shut down the argument vortex? I've tried calmly stating that I'm not going to continue to listen and walk away, but that ends up causing an escalation in violent, explosive behavior. So Lisa, that whole thing is a show right there. It's kind of, like if you're going to disengage from me, then I'm going to up the ante. So then the thing for that is, and this is, a little more than I can get into here, but to not have any reaction to, being, the explosive behavior. Okay. And the idea being is that, as long as you're acting this way, you will get no attention and I'm not going to engage with you. All right. So really think about it this way. It's that, you're not giving me what I want. So I'm going to up the ante and try to control you through behavior. All right. And as I always say to people, kids who are violent or, physically aggressive need to experience natural consequences for those behaviors, whether that is calling the police, whether that's taking them to the hospital. And what I can tell you is when people don't do this and they don't let them experience natural consequences because they're more concerned about protecting their kids' feelings, I will tell you they regret that in a few years. Okay. So, again, this is something I'm going to cover in the upcoming webinar series, Scaffolding Better Behavior. But that's really kind of the key here is that he has to understand, kind of like what I said in my video last night, that when we talk about, screaming for scaffolding, he needs to know where the end of the line is. And the end of the line for me is any type of physically aggressive or violent behavior. Okay. So Melissa asked, age 9 lying, lots of lying. I heard you say he needs to fix it, like the broken remote, and not focus on the lie. But what about lying about what shows or games he played at his friend's house? Well, I guess, Melissa, here's the thing. If you're concerned about what games he's playing or what shows he's watching, then that's not something to talk to him about. That's something to talk to the parents about beforehand and say, look, I just want you to know, I don't let him watch whatever, so are you okay with that? All right. And because, beyond that, the question I would ask you is, if I was 9 and watching something I knew my parents wouldn't like, I would lie about it. Right? That's kind of fun. To do something that, your parents don't want you to do. Okay. That's developmentally, that's pretty appropriate for me. So I just wouldn't get into a back and forth about it. And again, talk to the parents if he's over somebody else's house. With the virtual school going on, screen time is longer and for hours. Yeah, that's a problem. He sneaks into YouTube channels and keeps lying, tired of monitoring and reminding him to stay focused. It's a little gray. I'm sorry, I don't know how to pronounce your name. Is it Amirida? So I'm going to, forgive me if I pronounce it wrong. Here's what I would tell you, that talk to the technology director of your school district or the school and say, to give a kid with ADHD a distraction and not expect them to get distraction is unrealistic. What I'm going to tell you is don't worry about it. Okay. You cannot stress yourself out over this. This is what's going to happen. And this is the school's doing. If he has YouTube on his Chromebook or whatever, it is what it is. Okay. There's not going to be any long-term damage from this. I promise you. So just let it go for now. There's nothing else. There's nothing you can do about it. The situation's out of your hands. It's in the school's hands to be able to give the kids access to it. Let's see. My son is 6. What is the most important skill to teach at this age? Perspective taking, reading the field, episodic memory. So episodic memory is not a skill we teach. Episodic memory is how we connect past experiences and emotions from past experiences with the present to help kind of build connections between things. So that's an excellent question, though. I think for 6, if I had to pick one thing, really for 6, I'm going to say is reciprocal play skills. So the way that kids develop, social skills and executive function skills naturally is through unstructured play that is not being directed by adults, where adults are not, helicoptering over them. So really think about it this way, how to play fair, how to, make sure that, you listen to what other kids want to do and others' ideas. There's a term for that, sharing and imagination. So, if you're playing, let's whatever, a made up game, that, you both kind of take turns with it, and also helping him to be flexible to play along with what others want to do, even if he doesn't want to. And that's really kind of the most important piece there, is developing those reciprocal play skills at 6. All right. 7-year-old gifted ADHD. Do kids with ADHD cycle with behaviors? We've seen a pattern of good behaviors for a month or 2, then we see not so good behaviors for a week or 2. Yeah, absolutely. That's completely normal. My son used to do that all the time. All right, let's see. Age 9, our son has both anxiety disorder and ADHD. Does one feed the other? Treating both with medication is difficult. Should one be the priority over the other for treatment? Yeah, that's a great question. So, Julie, what I would say is it's about 25 to 30% of people with ADHD also meet the criteria for, an anxiety diagnosis as well. And, it's kind of, in terms of saying, is there one kind of more important than the other? It's interesting. Nobody's ever asked me that. I would say this, if, they're equally important, but if we're talking about long-term, my greater concern is that the anxiety doesn't get out of control. So what that really means is to not accommodate the anxiety and, for you to learn how to do that. And I'm going to make a suggestion for a book, and I can't remember the name off the top of my head, but it's Dr. Ellie Leibovitz from Yale University just put out a book for parents. I think it's a light blue cover. You'll find it on Amazon, but you should absolutely get that book because I think it'll really help you learn how to deal with the anxiety piece. Because really, it's parents who are going to help with that, not sitting in a therapist's office. And, keep in mind, and I just went through this today, a lot of times people will say, oh, well, CBT, that helps with anxiety. Cognitive behavior therapy, or CBT, has been shown to help older teenagers. It's effective for older teenagers with ADHD and adults, not for kids. And the reason for that real quick is, I believe, because CBT, which I'm trained in, requires a great deal of self-directed talk, which just our kids don't have. It's not that developed for most of our kids. So that's what I would say. Leah asked suggestions for play dates with another child that also has ADHD, age 7. Yeah, Leah, what I would say is, think about structuring it kind of, and give them like kind of 2 options at a time, okay? So for 20 minutes, we're going to do this, and then 20 minutes, we're going to change and do this. And, you can give them some free time too, just to do whatever, play Legos. But I think really the key is to keep the activity kind of short. Because they, they might, they don't have the attention span maybe to sustain attention for long enough. And I think then the other pieces with that is to kind of, scaffolding for options. So what I always say is, give like 2 options and say, you can do this or this. All right. And talk about beforehand with him. Here's what being a good host looks like. Explain to him what being a host means. And that when a friend comes over, we want them to feel comfortable at our house. And, we're going to ask them, sometimes if they're hungry or if they need the bathroom, so you want to teach them the whole idea of helping, being a good host and helping a friend feel comfortable when they're at your house. Let's see. Eileen asked, rewards or withholding rewards doesn't work. Well, here's the thing, Eileen. So let me read the whole thing. Rewards or withholding rewards doesn't work. What's a better method to motivate a 7-year-old? Yeah, Eileen, I don't agree with that. The problem probably is that your rewards are too far in the future. It's outside of the time horizon, so therefore they're not effective. That's why things like, star charts, reward charts tend to not work for kids with ADHD. And I'm going to cover this in, again, to keep going back to this in Scaffolding Better Behavior, my new webinar series. So think about it not as rewards, but how we have to incentivize getting through non-preferred tasks, okay? And I've never met a kid who doesn't have something that will motivate them. So let me just, mention that. Let's see. 9 out of 10 times my 6-year-old will only complete a task if bribed for a reward or threatened to take something away. How do I end this vicious cycle? So let's talk about this, okay? A 6-year-old has the executive functioning of a 3 or 4-year-old. I wouldn't expect a 3 or 4-year-old to complete a task, on their own. And I certainly wouldn't expect a 3 or 4-year-old to be able to do it if they, were threatened. So I think what's missing there is probably enough scaffolding. And I think your expectations might be a little too high for him or her. Okay. So think about, again, this is more about what a 4-year-old can do independently, not what a 6-year-old can do, 3 or 4-year-old. Blair asks, Blair, you know what? Let me try to pull the book up right now on Amazon so I can show it to everyone. That's Ellie Leibowitz's book. Hold on one second. Ellie, there it is. Okay. The book is called, it's Breaking Free of Child Anxiety and OCD, a scientifically proven program for parents. By the way, I did training in this methodology. It's called the SPACE program out of Yale University. And I'm going to focus on this in an upcoming webinar series that will also be on my membership site. But it is available on Amazon. Just came out a few months ago. Okay. Let's see. Next one. The whole family is working together to complete a task like dinner cleanup, and he makes a huge deal over everything he's asked to do, age 6. So I call that noise, which is complaining for the sake of complaining. Very normal for kids with ADHD to make a lot of noise. Just don't give any attention to it. Because again, when you give attention to it, you're reinforcing it, that the behavior works. Okay. So that's what I would say about that. All right. Any other questions, or is that it? Did I think I got everything? Just making sure. I'm sorry. I didn't see everything. Okay. So Erica asks, when fairness cannot be achieved because of outside circumstances, how do we help them cope? I just, Erica, I would say acknowledge how they're feeling and don't get into a whole talk about it. Let it go. Because, I think a lot of times what happens, I know, a lot of times, parents prolong things. And one of the way they prolong things is, it's a new term I'm using, is called playing armchair therapist, So there's way too much talk that happens around these things, and that then it gets perpetuated. All right. It's okay we want to just acknowledge the feeling and say, and it's okay to feel that way, and you'll feel a little better, soon. And that's all. There doesn't need to be more discussion than that. Because again, the more you discuss it, the more you play armchair therapist, why do you feel that way? And how does it make you feel? And this and that, it's just perpetuating it. And we don't want to do that. All right. And I just want to mention real quick, because of this, one of the things that I want to tell everyone I see a lot from, whatever parenting experts is a lot of this playing armchair therapist. So, validate how he's feeling and talk about it and this and that. There's nothing wrong with that. Yes, you should acknowledge kids' feelings, but it doesn't have to be a long discussion, right? And you don't have to start trying to get to the deep root of everything. It's just not necessary. Let's see. Okay. Amy asked, our mornings and evenings, pre-med and post-meds, are becoming increasingly more challenging in terms of defiance, extreme hyperactivity, recommendations. Yeah, so Amy, I think you're going to have to, have more scaffolding. Really, for those routines, that the best thing I can offer you is webinar 2 of Executive Function Crash Course. I teach how to create scaffolding around that. And part of it's going to have to be also with incentivizing, the behavior with, some kind of immediate tangible incentive. I don't like to use the word reward, but that's how we have to drive the behavior towards that. And then the other piece is kind of like what I was saying before. If, there's negative, attention seeking, and it's working and the behaviors are getting reinforced with attention, then that has to stop as well. Julie said, are you going to discuss your membership program? Julie, thanks for asking. As soon as it's completed, I will. Yeah, I'll do a whole thing about it. I'll take people through what it looks like. So I'll definitely do that when the time is right. Yeah. How do we teach self-talk to a 7-year-old, and what are some good discipline ideas? Well, okay, let me just answer one of these. So keep in mind, a 7-year-old executive functioning of, a 4 or 5-year-old, very little self-talk there. So what I would do is use the language, that I use with Brain Coach. You can show him or her some of my elementary school Dude Talk videos. And really, the other thing is to use declarative language to help build that self-directed talk. You can watch the ADHD Dude Live with Linda Murphy, the first one she did, where she talks about using declarative language. And you can also check out her book, The Declarative Language Handbook, which is available on Amazon, and watch the ADHD Dude Live with her as well. All right. Jeff asks, will this video be available to watch later? Yeah, Jeff, I leave everything up here. So yeah, it doesn't go away. Kim asked, what is an appropriate level of prompting for a 9-year-old? We are trying to have our son use his inner brain coach. We have to keep reminding him of basic hygiene as well as daily chores. Yeah. So Kim, the whole thing is you want to move away from what it's called prompt dependence towards independence. Okay. And again, I'm going to refer back to webinar 2 of Executive Function Crash Course for Parents. I teach you the scaffolding in there and the language to use to shift away from prompt dependence towards independence. All right. So it's, it's not just the prompting that you have to stop. It's a transition that has to happen. That's a combination of language and the strategy. And that just, brings up a good point I did want to mention. A lot of times people will reach out to me and say, oh, can you work with, my son on executive functioning or this or that? And I just want to make it really clear to everyone. Kids cannot improve their executive functioning on their own. They can't improve their executive functioning, by sitting down and watching a video. Parents have to create, again, this word scaffolding to help build those skills. All right. That's part of the reason why individual therapy does not work to address executive function challenges, right? Because it's not creating scaffolding. And as I've always said, the mental health field has completely ignored the tremendous role language plays in helping, build executive function and social skills. I don't want to say they ignored it. I just don't even think they know about it for the most part. So, let's see. I'll do a few more. Heather asked, very resistant to any requests, getting dressed, brushing teeth, bath, homework, particularly after meds start to wear off. So Heather, basically what I said before, needs to be scaffolding around what that sequence of routine looks like, covered in webinar 2 of Executive Function Crash Course. I feel like a broken record saying that over and over. Okay. And then the other part of that is, as again, I mentioned, incentivizing getting through the non-preferred tasks. Part of that is covered. Well, it's all covered in the webinar. So that's really key there. Okay. Acts like can't do it, negotiates a task saying I'm doing something. Am I expecting? No, you're not expecting too much, but I guess I wonder, Heather, are you feeding into learned helplessness if he says he can't do it? But again, if there's no motivation there to do it, it's probably not going to happen. Okay. Or if there's no incentive there, I should say. How long do we allow natural consequences to happen? My 9-year-old is late to school daily because he can't find a toy or his parents aren't comfortable one day. So it's a whole argument and he's late. So here's what I would tell you for that. I would, tell the principal, say, whatever, if, he needs to, have an after school detention or whatever for being late, please do that. Please do not protect him from experiencing natural consequences. I will say, I hate when I see kids staying in for recess. They need recess. But ask the school or, the principal to help you with that. All right. Cause he does need to experience natural consequences. And I guess the other thing is, how is getting, ready on time incentivized in the morning for him? If there's no incentive, then that might be a little problematic. The other part is, I would question, are you being a little too lenient, and again, I'm going to use language accountability, saying you can choose to get in the car now, or you can choose to, not have your tablet time after school. So I want you to have your tablet time, but you get to make that choice. Okay. And that's what language of accountability sounds like, right? It's putting all the accountability on them for the choices they're making. All right. Yeah. So Jamie asks, son age 8 will punch himself in the legs when upset or call himself an idiot when upset or shamed. Is that behavior normal? Is it attention seeking? Yes, Jamie, it's attention seeking. And, what it often is, and I cover this in the new webinar series, it's a type of emotional manipulation. And when I say emotional manipulation, I want to be clear. It's not, anything vindictive. It's kind of, I want you to, feel sorry for me. But it also, think about what that behavior does. It gets him probably empathy, and it gets your undivided attention. So what I would say is, you can, be present with him. Just don't respond to the behavior at all. Do not give him reassurance. Don't say, no, you're smart, anything like that. Just don't say anything. Just be present with him. Okay. the message we want to send is, I'm not going to respond to these behaviors with attention or any kind of reassurance whatsoever. All right. Very common thing for kids with ADHD to do that, Jamie. 8-year-old in June, regarding emotional dysregulation, he has major meltdowns over not getting things he wants, approximately 3 to 4 times a week. Well, first thing I would ask you is he medicated? How do I handle this? Do I just let him calm down? I would need more information to be able to answer that. Yeah. Okay. Did I get everything here? Because there's a little bit of a lag. I can do like 2 more questions. Oh, thank you, Erica. I appreciate that. I just want to tell everyone who's kind of more new to me, the Executive Function Crash Course series will be available at my membership site when it launches in, about a week. I'm hoping it'll be 7 days. And these strategies have been used by thousands of families. So, just know that, they're not coming out of the blue. I mean, these have things that I've been using for years with families, and, when it was available for individual purchase, thousands of people use them. So I think you'll find them very helpful. All right. Let's see. Lisa asks, is it appropriate to accelerate natural consequences? 10-year-old that I suspect of stealing from the local gas station, Oreo treats, taken there, explain to the manager what you suspect. Well, here's the thing, Lisa, that's difficult with that. Unless you're positive, I would say no, but I would say, if you're there and it happens, that's a different story. Or if you're positive he does it, then yeah, I think it is okay to call the police, So yeah, but we don't want to start accusing him unless we're absolutely sure. Okay. Kat asked, even taking away screen time in the midst of stay at home for a kid who appears to care nothing else is not, Kat, that's not, taking away screen time is not motivation, that's punishment, right? So I've never known anybody who kind of does better with behavior by being punished, right? That's not going to change behavior for the positive. Incentivizing, getting through things that are difficult for them to get through is what we need to do. I just want to remind everybody, ADHD is, which is a horrible name for it, right? It's difficulty sustaining attention to non-preferred tasks. So if you have difficulty sustaining attention to non-preferred tasks, you lack the resiliency to get through non-preferred tasks, punishing you is not going to change that, right? Punishment does not get rid of ADHD. That's what I always say to people. All right. Lisa said, my son, 8, gets fixated on a new hobby like karate or guitar and then loses interest quickly. Lisa, that is a very, very classic ADHD thing. Any strategies for helping him see things through, or just normal 8-year-old behavior? I would say, Lisa, it could be 8-year-old behavior, but it also could be, ADHD behavior. And I think at 8, we're still kind of trying things out. So I wouldn't make a big deal about it yet. But here's what I would tell you. Put time parameters around it, okay? So let's say, he's trying karate, okay? Say, we're going to try this for 3 months, or with guitar, whatever. We're going to try it for 3 months. So what we want to do is we want to push him a little bit past his typical, attention span for something to see how that works, and to see if something could stick if he starts to feel a level of competency with it. So in my last ADHD Dude Live with Linda Murphy, we talked about her new book, Co-Regulation, and one of the things she talked about is this concept of, oh my God, I'm losing the term right now, of competent roles. So what we want to see is, can he feel competent playing guitar? Can he feel competent, doing karate? Those kind of things. That's what we're trying to figure out. Okay. Okay. So back to 8-year-old in June regarding emotional dysregulation, major meltdowns over not getting things he wants, approximately 3 to 4 times a week. How do I handle this? Do I let him calm down on his own? I would say yes. So if we're talking about not getting free time, well, what I need to know is that an executive function issue because he's getting distracted? Or is it because you're taking it away? What I would say is I wouldn't suggest taking away free time. Kids with ADHD, they need a lot of decompression time. But the meltdown for not getting a treat, yeah, just completely ignore the behavior. Okay. And I want to also mention, people often say to me about this, well, how can I ignore the behavior? It's whatever. Well, if has giving it attention worked, has punishing the behavior and over worked? Okay. So if it's not working, then try something else. You know what I mean? And by the way, I just want to mention, because I like to give credit where credit is due, I originally learned of this concept from Howard Glazer, who started the Nurtured Heart approach. And it's kind of based on the premise, right? We don't give energy to unwanted behaviors, All right. And these are really great questions. Thank you, everyone. I really appreciate these. My 8-year-old has problems regulating himself socially, which makes him an easy target for others, pointing out his differences and then picking on bullying him, which he notices immediately. So one of the things I want to mention is, again, for kids who have social learning challenges or difficulty with social skills, they have difficulty with perspective taking. So I see a lot of 8-year-olds who might be bossy, try to control things, or they might do things that irritate other kids. And then when other kids have a negative reaction to that, then they perceive that they're being bullied because they don't understand, how their behaviors or words brought on these behaviors. So what we have to do is we have to help him understand the sequence of events. So, this were your words or behaviors. This is how the other kids felt about your words or behaviors. This is how they, responded to you about your words or behaviors. And then this is how you felt about yourself based on how you were responded to, okay? That's kind of the sequence of teaching perspective taking. All right, just, trying to empathize with him is not going to teach him that. All right, thank you, Karen. That's very sweet of you. I appreciate that. Real quick before we finish up, if I could please ask everyone, I would greatly appreciate it. I'm going to put a link in here. If you wouldn't mind leaving a brief review on my Facebook business page, if you found this helpful, I would really appreciate it. So there's a link there. Just click on that. So this is the ADHD Dude and Chip Camp page. You'll see a thing, do you recommend ADHD Dude? And yeah, if you could just leave a little short review, it would mean a lot to me. Thank you. All right. I guess last thing, real quick. So again, with my upcoming membership site, it's going to be the Executive Function Crash Course series and Scaffolding Better Behavior and Self-Confidence. That will be the two there. I want to just mention the second one real quick, the new one, which is the behavior therapy or parent behavior management program, whatever you want to call it. Besides it being the first one ever in existence specifically for parents of kids with ADHD, I'm looking at it as a constant work in progress, meaning I'm going to keep adding to it. I already have ideas for things I want to add to it. Obviously, I want to get it out there first. But part of what I add to it is going to be based on the feedback of, the members. So it's not just going to be me putting stuff out. Some of it will, but I also want to be responsive to the members and put out, the information that they will need that, will be helpful. In the fall, I'm going to add the social skills for boys one. That will be the only gender specific one on the membership site. Nothing else is gender specific. And then after that, I will do the anxiety one as well. And then we'll see what else comes along. Yeah. All right. So just I'll take one last one. Selma, yes, this will be posted. It's on YouTube. It's staying there. Yeah. Thank you, Jeff. I appreciate it. Thank you, Lisa. Always. I'm so glad you're here. Jamie asks, I'll take this last one. To the perspective taking comment, how do you do that without making him feel shame or like he did something wrong? So Jamie, let me answer the question this way, and this is a great place to end, okay? If you're more concerned about protecting his feelings than teaching him perspective taking, then, other kids are going to teach him social ramifications. So we can take this from, he can learn this from somebody who he knows loves him unconditionally, or he can learn it the hard way from other kids, ostracizing him and rejecting him. So what I say is teaching social is teaching accountability. And if you are more concerned about protecting feelings than teaching this, he's going to learn it the hard way. Okay. And part of that is, feeling, rejection from your peers is a lot more hurtful than your parents trying to give you some constructive feedback, okay? Or even getting criticism from your parent. One of the things, and this is the last thing. Oh, thank you, Lisa, for letting me know that. This is going to be one of the last things I will tell you. Let me just put in the new link for the Facebook business page here. Yeah, so again, if you could please leave a review, I'd really appreciate it. Last thing I'm going to end on to Jamie's comment is, you are not the judge of your son or daughter's social skills. I'm not the judge. The teacher's not the judge. The judge of your social skills is your same age peers. Okay. They are the ones who decide your level of social competency. So my feeling is, right, we want, obviously we want to teach these things because this is a really slow process, social learning. So we want to be able to teach things because as kids get older, social expectations increase. And I want to mention part of the reason why next week I'm doing specifically a 5th grade, ADHD Dude Live is because fifth grade is when things tend to go south socially for a lot of kids, particularly the second half of fifth grade, which I'll talk about next week. So yeah. All right. So thank you. I'm so glad you were all here tonight. I really appreciate you being here. Yeah, that's great. All right. I hope this was helpful. Again, if you could leave a review, I'd really appreciate it. Please subscribe to the channel. You can come back to it anytime. If you never want to come back to it, that's fine. But I do post new content here every week as well. And all my videos for kids are in the Dude Talk playlist. And there's also ones by age. Okay. All right, everyone. Thanks so much. And I will speak to you soon. Take care. Bye.